Good afternoon and welcome to Maine Community Health Options Educational Webinar. Today's focus is on our new behavioral health telemedicine program called Health Options Online. This webinar is presented with American Well, who has partnered with us on that project. Before I change over to our first speaker for the day, I'm just going to cover a few housekeeping items. Everyone on the call has been muted so that we don't hear any background sound as you are eating your lunch or working on a couple other things. Additionally, if you have questions, you can ask them two different ways. There's a little chat feature at the bottom of your controls and questions, so you can ask questions over the chat box and we can answer them at the end, or we can stop and break during the middle of the presentation if you would prefer. Additionally, you have the option to raise your hand. There's a little hand button on your controls and we can unmute you and you can ask the question over the line. Just so everyone knows, this webinar is being recorded and we will have this available in the next couple of weeks on the Community Health Options website in Employer Resources. So you can come back and watch it again. Additionally, the slide deck will be available via PDF. If you have any questions, we are happy to send it to you beforehand or answer other questions. At this time, I'm going to turn over the mic and the controls to Chris Kennedy from Community Health Options, who is going to introduce the presentation.
All right, thank you. This is Chris Kennedy with CHO here. I'm the Director of Provider Network and Operations. Thanks for joining us. Welcome. CHO is a nonprofit co-op plan, as you all know, operating here in Maine since 2014, offering health insurance licensed here in Maine to employers, as well as individuals and families who buy their insurance on their own, both on and off the marketplace. Very excited today to share with you our topic of our new behavioral health telemedicine program in partnership with American Well. Today, from American Well, speaking with you today is Mike Russo and Dr. Lindsay Henderson. Mike is the Director of Client Engagement at American Well. With over 10 years of account management experience and with the national employers, at American Well, Mike works with employers to drive engagement, telehealth utilization, and member satisfaction. Passionate about driving members to high-quality care through telehealth. And Dr. Henderson is a clinical psychologist and director of psychological services with AmWell. She received her undergraduate education at St. Lawrence University and master's and doctorate in clinical psychology from William James College. Prior to joining AmWell, Lindsay was a staff psychologist with McLean Hospital in the Boston area and clinical instructor in psychiatry at Harvard Medical School, specialized in working with adolescents and families there. As director of AmWell's therapy program, Dr. Henderson focuses on fostering connection, learning, and treatment programs to address specific clinical needs such as chronic illness, pain management, and addiction. She also actively sees patients through the system and absolutely loves practicing in a telehealth setting. Introduction of both speakers, there you go. And with that, I'm going to kick it off to Mike Russo to begin the conversation. Thank you.
Thank you, Chris, for that wonderful introduction. And thank you, everybody, for being out there and taking some time out of your lunch to join us as we discuss the tele-behavioral health solution that Community Health Options has put into place for us today. As Chris said, American Well is a established telehealth provider, been in the business for well over 10 years. You started with two brothers down in the Boston area. And continue to grow to this day as a telehealth firm. So behavioral health is one of our great services that we offer, clinical service that we offer to your employees, as well as, so we look forward to, showing you how we can help your employees seek the best behavioral health care they can find. Our mission at American Well is to connect and enable providers and patients and innovators to get great access to high quality care. And that's what we're here to showcase to you today, is how your employees can find that great high quality care. Another great thing about us is our culture and our values. You'll notice that customers are first. We want to make sure our focus on our platform is that your customers, our customers, are getting a great service experience when they come here, similar to what they would traditionally expect to feel in a brick and mortar. Their customer first focus here is important, and that we're all one team. We're here to deliver the high quality care as one team and make sure that the patient is getting exactly what they deserve, and most importantly, deliver awesome. I think is one of our greatest attributes as a company. So that's who we are, a little bit about us. How do we do this? Telehealth is available everywhere you are and when you are needing care. We have different many different avenues that we can deploy telehealth solutions to you and your employees, whether it be through the mobile apps that you can download from your iOS stores or Google Play Store to find access to us, or through your desktop computer and having a web application where you can just find that moment where you need to talk to someone. Or even phone. We actually still have, people still use phones, traditional landline phones, and you can still interact with some of our practitioners in that way. We also can deploy kiosk solutions at residents or at different employer sites, to help facilitate that level of care as well. Go to the next slide. So Maine Community Health Options has opened up what we call a practice. This is what it would look like when you actually enter into the behavioral health practices for Community Health Options. You would see you'd have a therapy practice and a psychiatry practice. These are all scheduled appointments that employees could schedule with one of our practitioners here at the through our online care group, which Dr. Henderson is going to go over a little bit more detail as we get through the presentation today. These are the services that are offered available to your employees today, as you can begin having these visits and scheduling these visits shortly after our presentation ends today. Again, these are scheduled appointments, so you can definitely access that information there as well. One last thing I wanted to point out before we dive into Dr. Henderson's presentation is, how graphically easy it is for your employees to see care, to make it feel like it's traditionally what they would see in the brick and mortar place. So, obviously, it's interactive for them. So when they come through the platform, they can enter in their own medical history, capturing it just like they would at a clipboard in a doctor's office. Now we're capturing it through the electronic platforms that we have available to them. And we're even actually, when you're on a mobile application, if your prescription was needed or something of that sort, we're actually helping employees find the nearest pharmacy for them. So if they're in an unfamiliar area, because we know telehealth is something you're taking with you. I always like to tell when I'm off at employer groups, our doctors like to go on vacation with you. So you can take your doctor anywhere you're going because they're always in the pocket or on your phone or wherever you are, so you can interact with them. And again, it's a delightful experience for your employees to access telehealth, again, because it's convenient. They're not driving to some doctor's office. They're wherever they are. They could be sitting out looking over a nice water area, or they can be sitting at a park taking a visit and talking to one of our therapists as well throughout the day. So, Lindsay, I think the next slide is yours. I'll let you tell. Oh, no, sorry, one more slide. Again, how we make it interactive for you is actually entering the insurance information that is applicable to you and your membership through Community Health Options. This information has all been set up and streamlined through the process so that your claims will be adjudicated properly. So again, the Community Health Options is the health insurance information. You can see how we have the card loaded there, so you know which fields you're entering in for the subscriber ID, and how to go about entering all that information through your intake. So I just wanted to make sure we highlighted that information was there for you, as you and your employees get used to familiarizing using our platform. So, and then one last thing, again, to make it interactive and easy, is we actually offer multiple multi-way visits. So honestly, with therapy and some of those other things, if you need to have like a family counseling session, you can actually open up our platform to multi-way visits, so that multiple people could take part in a conversation through telephonically. So maybe your child needs support and he or she is away at college. You can definitely help, and by setting up that visit, a mom and dad can help listen in as well if there was some sort of counseling needed to happen, or any other allied health provider solutions that need to be facilitated. Now I'll turn it over, and with great pleasure, Dr. Henderson can review a little bit about why behavioral health matters and how the solution is available to you and your employees. Lindsay, you there?
Okay, sorry about that. I was muted on both ends there for a minute. Hi, everyone. Thank you so much for taking your lunch and listening to us talk about our behavioral health offering. As a clinical psychologist, I am super excited about what telehealth is able to do for the field of behavioral health, as we are passionate around improving mental health across all Americans. Why does this matter? Why do I care about the delivery more effectively of behavioral health services? What we know is that 1 in 4 American adults experience some sort of mental illness in any given year. and less than half of those folks actually receive any sort of treatment for that. There are over 14 million Americans who have a serious mental illness, so you know, it's totally normal and expected that anyone on this call, including myself, would experience some bout of depression or anxiety at some point in their life. But then there are those who experience the more serious mental illnesses. That population, their mortality rate is 25 years less than the general population due to the chronic comorbid medical conditions. We know that behavioral health and more comorbid medical conditions and chronic medical conditions overlap to contribute to just shorter lifespans and much higher costs within healthcare. So you can't address chronic medical conditions without addressing the behavioral health conditions that so often come along with them. Then there's those 9.2 million adults, and that's probably a low number, who have co-occurring mental health and addiction disorders. And we all know that addiction and the addiction crisis and epidemic is at the forefront of America's mind right now, as we see so many of our colleagues and peers and community members struggle with the epidemic of addiction. And then there's those under the age of 18 who also experience severe emotional disturbances and who have, in many ways, a much harder time accessing health than even adults do, or health treatment. Let's see, get my slide. So we know that there's a high prevalence of mental illness, but what we also know is that there's a huge provider shortage for behavioral health providers. Approximately one mental health provider exists for every 790 individuals. There are only 28,000 psychiatrists in the US today. And something like 65% of non-metropolitan counties do not have a single practicing psychiatrist. Half of those counties also don't have a single practicing psychologist. And we know that in states like Maine in particular, so much of your beautiful state is rugged and rural, and you have residents spread out through your vast state who are very unlikely to find a local mental health provider that they're able to access. So that is why telehealth is really a game changer in the field of behavioral health. This is just a map that is a little bit busy, but kind of breaks down the shortage of mental health providers across the country, particularly in rural communities. So we know that rural communities have a limited access to mental health care, and that problem is only growing. I practiced at McLean Hospital prior to joining American Well for almost a decade. And even in Boston, Massachusetts, which is like the epicenter of psychiatric care and training, we would struggle to find outpatient resources for our patients to discharge to. We also had people coming from all over New England, including Vermont, New Hampshire, and Maine, to access decent mental health care. So resources are scarce in many places. So you've got folks who are driving a couple of hours across multiple state lines in order to get to a mental health provider appointment. And as you can imagine, that's only so sustainable. And folks like that just generally are going to struggle over time to keep up with their mental health care. So why does this matter to employers? What's the impact on how individuals are functioning in the world and in the workplace? So approximately 1 in 5 adults will say that they did not get mental health support they needed. And what we know is that mental health illnesses are common and very expensive conditions. So approximately 85% of employee mental health conditions are undiagnosed or untreated. Mental illness is the 5th leading cause of short-term disability and the 3rd leading cause of long-term disability for employers in the United States. Mental health conditions cost employees more than $100 billion and 217 million lost work days each single year. It's a huge drain on companies and employers. And then those individuals with chronic medical conditions and untreated mental illness are even more costly. Depressed patients are 3 times likely to be non-compliant with their medical regimen. So they're less likely to be adherent to diabetes treatment recommendations or other sort of heart condition treatment recommendations. And healthcare costs are up to twice as high among diabetes and heart disease patients with depression compared to those without depression. So the cost of these untreated mental illness and behavioral health symptoms is something that is absolutely felt by all aspects of the healthcare industry, but also by employers as well. So we strive to make mental health care accessible in new and creative ways by using our secure, HIPAA-compliant private video software. That's me, you guys. That's me on that screen. This picture is from a New York Times Wirecutter story that they did reviewing online therapy platform options. So you can see that's me in my home office providing fake therapy to one of the writers there, but I'm an active provider on our platform, and one of my favorite things about this job is that I have seen the way that this technology makes mental health care accessible to people who otherwise would not be able to get it. And that's a direct quote that I hear from my patients. These are patients who are like you and me. We have full-time jobs. We have young families that keep us busy. We don't have a lot of flexibility to, to get to an appointment that is an hour a week, perhaps 20 minutes or 40 minutes across town, and commit to that for on a regular basis. It's just not something that fits into life. So how I see this shakedown for my patients is, I see patients at 7 in the morning before they go to work. I see patients at 12 o'clock and they've booked a conference room at their place of work and take me in for their lunch break and we do therapy there. I see one woman who takes her phone to her car in the parking garage at work and does a therapy session sitting in her car. And she describes her car as literally the most private space she has in her life. These are folks who are not really interested or able or comfortable in talking to their boss or supervisor and saying, hey, every Tuesday, I gotta take 90 minutes for a therapy session. Like that's not necessarily an easy conversation to have. But they can use their lunch break, leverage that lunch break or that downtime in their workday and fit mental health care in without anybody knowing. I also see patients at 8 o'clock at night when people are home from work and both I have put my children down to sleep and they put their kids to sleep, and they're able to access things from home without needing to come up with childcare options. And the accessibility and the flexibility is important for patients, but it's also important for your providers because it allows us to take care of our patients or your employees in a much more flexible and accommodating way. I am not looking to get to an office setting at 7 a.m. or stay at an office setting until 8 p.m. at night. But I am more than happy to be at home, put my own children to bed, and then go to my private and secure home office. And within 30 seconds after giving my daughter a kiss goodnight, be logged on and seeing a patient in a way that fits into their schedule as well. So let me talk to you about the online care group, which is what powers the behavioral health offering that you are making available to some of your employer groups. So we are a physician-owned provider group that practices exclusively online on American Well technology. And we are experts in telehealth and the practice of telehealth, both clinically and operationally. So we have a robust clinically trained network of providers, but we also have an incredible operations team that powers us and supports our day-to-day operations and tech functioning and clinical activity. So I won't go into too much detail about the online care group, but I feel like it's important for you all to know that we have been around for over a decade. We are a leader in the telehealth space, and we have learned a lot from all the work we've done. So we're really telehealth experts, both clinically and operationally. And we are the ones who would be taking care of your folks. So our behavioral health program has two different arms. We have our psychiatry program and then our therapy program. So our psychiatry program is powered by board certified licensed psychiatrists. And then our therapy program is powered by psychologists such as myself, and then master's level clinicians that includes licensed professional counselors, licensed marriage and family therapists, and independent clinical social workers. All of us have a license to practice independently. Within the therapy arm, we're all doing the same thing, which is 45-minute outpatient appointments. And our psychiatrists are doing medication evaluation and ongoing medication management. So we have nationwide coverage with over 900 licensed and credentialed therapists who cover across all 50 states, including lots of folks in the state of Maine. All of our appointments are scheduled visits. And what that means is that a patient will create a profile or an account with us and be able to log in and see what appointments they have available to them in their particular location, their state of location. So they can see our provider profile photos, read about our education, our background, our training, our specific areas of focus, and then see what availability we have to self-schedule by just clicking a few buttons. You can also search for scheduling by calendar. So say the provider is less important to you, but you need to see somebody on Wednesday afternoon. So you search for Wednesday afternoons and see who's available to you. And I have to tell you that folks love this feature. One of the biggest barriers to accessing mental health treatment is just getting into that first initial session. Most of the time in a traditional brick and mortar setting, this includes making phone calls, leaving voicemails, waiting for return calls back, doing a lot of Googling to find out who might be taking patients, potentially looking at your health plan's directory of providers, often which is either outdated or many of them are not accepting patients at the time. This eliminates all of that. It's also, by the way, very difficult for most folks to pick up the phone and call and actually tell somebody, I'm struggling, I need to set up a therapy appointment. This takes a lot of that out of the equation and allows people to just comfortably go online and pick what fits in their schedule and not have to talk to anyone until that actual first appointment. So people love this. You are able to schedule an appointment up to 15 minutes prior to the start of that appointment time. So while it's not on-demand services, if I log on in Maine right now, I might find that there are 3 providers who are offering 4 different appointments for later today that I could book. So that's another difference between online treatment and brick and mortar treatment, is that often it takes many weeks to get an appointment in a brick and mortar setting. And a lot can happen in those couple of weeks, not the least of which is that that person may kind of lose their gumption for getting into therapy, for taking that step towards mental wellness, because it is such an intimidating thing. So as much as we can reduce the time from point of initiation of attempting to be in therapy and then actual appointment time, the better outcomes we're going to see. We do have child and adolescent coverage. Once that initial appointment is scheduled and you make that connection via video with your therapist, it really does feel like normal brick and mortar therapy. So people are sitting, chatting, using video software, which, by the way, most folks are pretty increasingly comfortable and adept at, no matter what their age. We're used to FaceTime, we're used to Skype, and so pretty soon what patients experience is that screen falls away and you're just sitting with a provider and you are having the same experience and treatment that you would in a brick and mortar setting. So our providers are, they're doing an initial evaluation, ongoing assessments, and treatment. They decide what frequency of meetings is going to be most appropriate and dictate the course of treatment depending on their clinical skill and interpretation of what is needed. So we are seeing the same common conditions that you would see in a brick and mortar setting. Lots of depression and anxiety, lots of family, relationship, and parenting stress. We see more serious things like bipolar disorders, eating disorders, PTSD, you name it, we see it. And other than safety issues, there is no hard rule out for appropriateness for treatment in a telehealth setting. This is a little bit of how we measure our outcomes. The long and the short of it is that research has demonstrated so far that telemental health is just as effective as therapy in a brick and mortar setting. So we know that this works, and by breaking down the barriers of access and ease and flexibility of getting to appointments, you also are eliminating some of this areas for that folks feel stigmatized. Say you're in a small town, which there are lots of in the state of Maine. There may be one mental health provider in the area. And so going and parking your car in that office where people can recognize you and wonder what you're doing there, or where you might run into a colleague or an acquaintance in a waiting room. That's another thing that keeps a lot of people out of mental health treatment, especially in a small town setting, and it's avoided here. The patients, the short of it is that patients are very satisfied with their experience with us. I find our network to be really useful and the technology to be user-friendly. That picture I showed you earlier from the New York Times Wirecutter, which is their version of like a Consumer Reports type of publication. They did a really thorough review of online therapy services last spring and found Amwell's therapy offering to be their top choice. And that was based on both the patient's experience of the platform, so found it to be a delightful experience of the platform, but also based on our selection of providers. So our selection of providers, our network of providers is far and away larger than the other online therapy services that they reviewed. So our psychiatry services are much like our therapy services. These are scheduled visits. The initial evaluation, that initial appointment, is 45 minutes in length, and then each additional appointment is 15 minutes in length. Those are med management appointments. One question I get asked a lot is, do I have to see new providers every time I have an appointment? And the answer is no. Once you establish a relationship with a provider, that provider will book ongoing appointments, just like in a brick and mortar setting, so that you have a continuous treatment relationship with one provider. Right now we have nationwide coverage for ages 18 and older in psychiatry. It is a future goal of ours to expand that to child and adolescent services as well. As with therapy, we've got appointments that are available during a wide variety of times, including nights and weekends, and that's something that people take advantage of all the time. One nice thing about the online care group is that we function as one large medical group, which means that with the patient's permission, we're able to see, say one of my patients is also seeing a psychiatrist. I can access that psychiatrist's notes. I can see what they're working on, what I should follow up with in my therapy. I can communicate with the psychiatrist within our HIPAA compliant platform using a secure messaging feature, which just makes coordination of care much more streamlined and likely to occur. So at this time, there is federal laws that prohibit the prescribing of controlled substances in a telehealth setting, and so that applies to all telehealth providers across the country. And one way we know that controlled substances can be an important part of the practice of psychiatry. So we developed what we call the psychiatric collaborative care model to help take care of those patients. We know that the bulk of our psychiatric prescribing in the United States falls to primary care physicians because there just are not enough psychiatrists out there to take care of all of the mental health needs of Americans. So primary care physicians, understandably, may get hesitant and feel ill-equipped to be the one prescribing some of the more complex psychiatric meds and also some of the more high-risk psychiatric meds like controlled substances. So the collaborative care model uses our OCG psychiatrist, a board-certified psychiatrist. A patient would come and have a thorough evaluation with an OCG psychiatrist who would write up, their documentation would include an evaluation and specific recommendations for medications, dosing, any labs or tests that might need to accompany those recommendations. And that record would be securely e-faxed to the patient's primary care physician. And the hope is that the PCP will, with the recommendation of a board-certified psychiatrist in hand, would feel more comfortable and empowered to be the one on the ground writing those scripts that the psychiatrist is not able to write due to the Ryan-Haight Act. The primary care physician has access to contact the OCG psychiatrist. Each of our OCG psychiatrists has an individual private voicemail. The voicemail is not patient-facing, it's just for other providers, and so that gives the primary care physicians an opportunity to contact the psychiatrist directly for any questions or collaborations or feedback. And then the expectation is that the patient continue to see both the OCG psychiatrist and their primary care physician for ongoing management of those medications specifically. So this program, while relatively new, we've received wonderful feedback around this, as the prescribing of controlled substances is something that it's a drain on primary care physicians. And many areas, particularly areas like parts of Maine, just do not have the psychiatrists able to take care of they don't have enough psychiatrists to take care of their residents' needs. It's also an example of how we can set ourselves up to collaborate with community-based providers. Our goal is never to replace or change some of the care that is going on, the good care that is already going on within the community, but rather to add to it and to strengthen it and to fill in gaps where our community providers are stretched to their max or just not able to take care of all the patients that need the services. And finally, I wanted to talk a little bit about how we are tackling addiction within the online care group and American Well, as this is a huge need across the country, as many of you guys know, and I'm sure intimately familiar with. We know that New England and Northern New England have particular struggles with various levels and forms of addiction. And at American Well, we are committed to being a part of that solution, and will be continuously evaluating how we can best treat these patients and evolving in how we tackle this national epidemic. But right now we've got therapists across the country, throughout our network, who are able to offer individual therapy for mild to moderate substance use disorders. So this includes, they're wonderful at being able to do some psychoeducation around substance use and addictive behaviors, focus on increasing motivation and commitment for change, some relapse prevention for those who, individuals who may be in remission, the diagnosis and treatment of co-occurring disorders. So we know that addiction very, very rarely, in my opinion, never stands on its own. It always comes along with some sort of co-occurring disorder, whether that is depression or anxiety or a history of trauma. There's always something else going on. So our therapists are mental health experts, so they're able to tackle the things that come along with drinking a little bit too much each night, or however it might look for your individuals. We're also able to offer therapy for the family members of those struggling with addiction, or loved ones of those struggling with addiction, as we know that that is, addiction does not just impact the one individual. It is a family disease, and its tentacles sort of reach out and touch all sorts of people surrounding the individual struggling with addiction. So, you know, for employers and employer groups, this is often what we hear a need for, is for individuals who are struggling with low to moderate substance use disorders, who might be you know, drinking too much each night, or who might be struggling to control some of their behavior on weekends, and who really want to try and get ahead of their behavior, or get to be in a more healthy place, but have a hard time finding an addiction treatment option that feels like comfortable and safe for them. So many addiction programs within communities, they are treating those who are in the more high risk or moderate to severe end of the spectrum. And so lots of your employees may feel incredibly uncomfortable in a treatment setting with folks who are in a more severe place with their addiction. And also, I mean, this is a particular area of where people want privacy as they access treatment. So what we hear is that our approach to addiction here is really meeting a lot of folks' needs. We do work to make appropriate referrals for those who are on the more severe end of the addiction spectrum. So anyone who is in need of medical detox, who has a high-risk pattern of use, whose use is unsafe to themselves or to others, who presents as intoxicated during therapy sessions. So a lot of what we see in like the headlines, news headlines, and yeah, you know, more and more often is talking about a much more severe, high use and extreme risk population of drug and alcohol users, specifically opiate users. And we are not set up to take care of those folks at this time. But there are a whole lot of Americans out there right now who need help with a lower level substance use pattern. So I wanted to make sure that you know, Michael and I left plenty of time to ask questions and you know, answer any questions that you all might have. So with that, I'm happy to open up for questions and discussion.
Just a reminder, if you'd like to ask a question, there is a chat feature on your controls where you can type in a question. We can read them out. You can also raise your hand, and I'm happy to unmute you and allow you to ask the question over the phone. I do have one question for you, Lindsay. As many of our attendees today are employers, how can employers help encourage a better kind of workplace to allow employees to seek treatment as needed?
Yeah, I love that question. So I think, Mike, you're the expert here on how some of how marketing efforts can really make a big difference for employers. Your employees need to know that these types of benefits exist and that they can access it. So I don't know if you want to touch on that at all, but I can also go ahead.
Yeah. So quickly, obviously, the number one thing, Caitlin, there is awareness. So obviously, making your employees aware that these benefits are there for them and how easy it is. And I think being open about it, that that these behavioral health needs are present in the workplace, they're present in our society, as Lindsay was outlining, and that you're being thoughtful as an employer to drive awareness to this and make sure your employees have access to this great quality care through their benefit cycle. So I think that's the most important piece of it, and then obviously providing them these private places where they and the time to have these visits throughout their workday.
Yeah, I was going to echo that. I think, there's all sorts of ways that employer groups are trying to, set up their physical office space for, to encourage employee wellness, whether that's, relaxation rooms or, healthy food options or places to privately take phone calls. I think that the physical space is a great opportunity to encourage general wellness, including mental health. I think also like the people need to know that they can trust that their supervisors or managers will allow them the space to take care of themselves. So how is this a part of your workplace culture? That mental health is, folks are aware of how important it is, and it's encouraged. Whether that's like literally, a conference room made available to you for 45 minutes, or a phone booth, or just like recognizing, making it part of the general conversation, so that employees feel like they can approach their managers and supervisors if needed.
And I'm going to add one thing to that. You brought up a really great point. Obviously the managers, but it's also we have found at American Well, our most successful employer groups, as they move into or begin offering telehealth services, whether it be through their health plan or directly with us, the most successful ones, the leadership from the top embraces telehealth and drives telehealth and finds ways to get that message across to them that this is a great avenue of care for my employees, and I support it. And by calling it out, I mean they will be walking through meetings and saying, who can show me they have the telehealth app downloaded onto their smartphone device, and maybe they hand out a reward for that kind of thing. Driving the carrot through engagement with their employees so that they're getting it, because it does drive care, and in the end will drive costs down for your health plans as well. And Caitlin, we can also work with you and your team and community health to get some marketing materials available for handout as well to help drive that engagement.
Yes, thank you. We do have an additional question come in. What information security is employed, and how will individuals' personal information be protected in the digital realm?
So we are a high trust certified company, and everything is into one platform. We do not. Your visit summaries and all that stuff, as Lindsay had outlined, is contained within our secure platform. A lot of other confidential health insurance information is not always maintained there. It's more of a pass through, so our doctors can read and act on the material that is being presented to them by the patient. But yeah, we are a very highly tested and secure platform. Have been tested by all the top cybersecurity platforms on a regular basis. So we're always staying on top of that kind of technology, because we do recognize the importance of that your member and your patient's security and identity.
Yeah, One question that I get a lot is, are visits recorded or stored in any ways? And they are not. So no therapy content is ever recorded or stored. It happens in real time, and that's it.
Great. Well, thank you for that answer. Does anyone else have any questions? We'll wait another minute. Well, great. If you have any additional questions, Lindsay and Mike, is there a best way to reach you?
Yes, so the Community Health Options team, so I am obviously the account representative for this relationship with Community Health Options and American Well. So obviously Chris and team can have a way to get outreach to me directly for any of the marketing engagement needs that you and your employees may need as you guys begin to begin going through this, developing your relationships with telehealth and your employees.
Great. Well, thank you, Mike. And just a reminder for everyone on the webinar, oh, I do have a hand raised. Karen, I'm going to unmute you. Karen, you're unmuted if you'd like to ask a question.
You said this was going to be videoed or recorded. Could you tell me how we'll be able to access that?
Yes, I was just about to do that. So you went
Perfect.
reading my mind here. So yes,
Great.
The webinar is being recorded and it will be made available on the Health Options website. Probably about a week or so. It takes a little lag time to get it up on the website, but it will be available on website. If you'd like it sooner, just feel free to email me and I will get that for you. My email should be in the thank you email that you'll get after this. And I'm happy to send it to you sooner along with the slide decks as well. So it will be online. Give it about a week or so. We'll get it up on the website. We are going to be recording some additional kind of how to do things videos in the coming weeks as well. And there is, if you do log in Health Options online through your member portal on Health Options website, there is additional guidance on kind of that walks you through the process of signing up as well. And if you need additional information, again, as Mike says, for marketing to your employees, we're happy to work with you to get that information for you.
Yeah, I think this would be helpful to some of the supervisors so that they know that this is available when they're talking to employees.
Great. Well, we're glad to hear that. And again, if you need additional information, feel free to reach out to us and we'll work with you to get that for you.
Great. Thank you very much.
You're welcome. Well, if there's no additional questions, we are going to close the webinar. But again, please follow up if you have questions you think of afterwards. Again, this will be on the website available as a recording. And thank you both, Lindsay to Mike, for presenting today.
Thank you.
Thank you. It was our pleasure.
Great. And at this time, we are going to end the webinar. So thank you, everyone. Have a great day.